Hey everyone, welcome to By the Numbers, a public health podcast. Today we're talking about childhood immunizations. Thank you for joining us. Hello and welcome to the very first episode of By the Numbers, a public health podcast. I'm Addie Olson and I'm the Public Health Communications Officer at the Polk County Health Department here in Polk County, Iowa. We have an awesome guest here today. But I first want to talk a little bit about the podcast since this is our first ever episode and we're launching this podcast by the numbers because our work in public health is, of course, rooted in numbers, in data, in science, and usually that data tells a really important story. So in each episode of By the Numbers, we'll dig into a single data point, talk about what that number means, and talk about the bigger picture that this data paints and how that affects our community. So thank you for tuning in for our very first episode. And I am excited to welcome my colleague, Susan Brooks, to the show to talk about a very timely topic as kids get ready to head back to school. And Susan, you are our health services coordinator focusing on the immunization program, which includes the federally funded Vaccine for Children program and completing school and child care immunization audits for Polk County. And you've been with us for almost 20 years.
Yep, getting pretty close in November.
Gosh. That is a long time. So thank you for joining me today for our inaugural episode.
Yes, thank you for having me.
Absolutely. And if you haven't guessed it already, we're talking about childhood immunizations, and the number we're discussing today is 6%. So the Polk County Health Department audits immunizations for kids in school districts here in Polk County. And last year, when we completed that audit, we found that nearly 6% of students in Polk County were not fully vaccinated. So I just want to start out by talking about what does it mean to be fully vaccinated?
So to be fully vaccinated, for the most part, all of the CDC recommended vaccines are required in some manner to some extent in school. So mainly we're talking about kindergarten through 12th grade. So you start out with DTaP, which is what everybody kind of calls tetanus, but there's other components to that too. DTaP polio, MMR, chickenpox, hepatitis B. So those are the main ones that are required for kindergarten. Then we build on that. So at the 7th grade level, we add in a Tdap, which is another tetanus, diphtheria, pertussis, and that's a booster to continue to protect you. And then the meningitis vaccine. And then we build on that again. At the 12th grade level, there is another meningitis shot that's required. So that, when you're talking about school required immunizations, that's what we considered fully vaccinated if you have all of those vaccines. Most of them are a series of somewhere between 2 and 4 doses to complete that series. So when we look at those numbers, or when we look at those vaccines, that's what we consider to be fully vaccinated. There are other vaccines that are recommended, but they're not required to be in the school systems.
Okay, so when we look at that 6%, nearly 6% of students were not vaccinated in 2023 when you did that audit last year. What exactly does that mean and what does that tell us?
Okay, so that 6% is a snapshot in time. When we go in and audit in the schools, we audit starting around this September 1st, and then we audit all through October. So when we're in all the different schools, it's just a snapshot in time. If we're there September 1st, your audit could look totally different if we came back the end of October because kids have caught up on different vaccines throughout that time. So that number takes into account 4 different categories. There's medical exemptions, so you might have a medical reason why you can't be vaccinated with one or all vaccines, just kind of depends. There's a religious exemption, so you might have a religious reason why you can't be vaccinated. There's provisional certificates, and that is kind of like a little contract that says you have at least 1 dose of each required vaccine to get into school, but you haven't completed the series. So it's a little contract that says we're going to allow you to start, but we need you to get caught up within a certain period of time. And that's usually about 60 calendar days. The law allows for 60 calendar days to get as far along as you can. Then the 4th category would be invalid certificates. So all of those 4 components make up that 6% when you add up all the kids that don't meet each of those criteria.
Okay. And I know you were saying that there was a recent change, right? So this audit was done at a different point than it has been in the past.
Right.
Because in 2020, that number of students who were not fully vaccinated when the audit was done was around 3%. And so now it's a little bit higher, but the audit's done earlier in the year.
Right. So back in 2021, the auditing, when we start auditing, changed. So the when we start now better aligns with what Iowa code says. Iowa code says that you're supposed to be done within the first 60 days. So historically, we started auditing October 1st, and we audited all through November. By that time, when we started auditing, kids had at least 60 days to get caught up. And so when we were auditing, a lot of those kids had had those first 60 days. They got their doses that they were missing when they first started school. And so now when we audit earlier, people don't have that chance to get caught up, so to speak, or complete their provisional certificates. They're still working toward getting vaccinated. And so even though that change gives a better picture, really, of what it looks like when kids start school, we have to keep in mind that the provisional certificates, those kids that are on that little contract, those typically resolve within 60 days. So that's the first thing that has made that number look different. I think it was 3% back in 2020, so now we're up to 6%. So that's the first part that plays into that number. So we've got more kids on provisionals than we did when we audited later in the year.
Okay.
The second one would be the increase in religious exemptions. We've seen a significant increase in exemptions. While this is concerning, religious exemption doesn't necessarily mean that that student is missing all their vaccines or that they've never been vaccinated. So they could maybe just be missing one dose of something that they weren't able to get, that they had a religious reason why they couldn't get. And we don't, once that religious exemption is in place, we don't, that's how it's recorded for that student. So it's not recorded as a religious exemption that just for this vaccine, but they have all the others. So those are the two reasons why we've seen that increase in number since 2020.
Okay, so one piece is the fact that we're doing the audit a little bit earlier in the year, and the other piece is that there is an increase in those religious exemptions.
Right.
Got it. And I guess, why is it so important that kids are vaccinated prior to school starting and don't have to, be forced to do it once you're already starting school? And I think that you said the other day it's planning your time to do it ahead of time versus being forced to plan your time. So just why is it so important that kids have their vaccines before heading into the school building?
So even though you have to have at least one dose of everything to start school, if you don't have a complete series, you're still vulnerable. You are vulnerable to acquiring those diseases. You are able to pass those diseases on to other people. So you are more vulnerable. You, as in the student, is more vulnerable. In addition to that, if you aren't compliant, then it's time out of school. So you started school, but now you only have a certain period of time to get vaccinated. So you still have to, most doctor's appointments are during the day, which is during the school day. So there's time out of school, there's time out of activities, there's interruption to your learning. When you're looking at it from the parent perspective, the parent's out of work to go to the appointment. And like you said, if you're doing it ahead of time, you get to plan when that time works best for you versus once you're in school, somebody's going to make that decision for you. You need to have it by this date or we can't allow your child to come back to school. So now you're trying to figure out when to get that done. So, you don't get to plan the time as easier. And then a lot of people want that certain time off of the year. So you're competing with other people. The doctor's appointments are harder to get that time of the year. So again, that's another thing that's choosing choosing the time and the date and everything for you versus you getting to choose it if you're doing it ahead of time.
Okay. And I think that the required vaccines are for diseases that you don't hear about super often anymore, which is likely because the vaccines are doing a good job, right?
Right.
But once in a while, you do hear about cases. And back when I was at Iowa State, there was a student who was there at the same time who got meningitis and actually ended up not making it. And it was really, I remember being really scared, like, what even is meningitis? Am I vaccinated, and having to check into all of that stuff. But I guess, what does it look like when we see one of these cases come through in someone who's unvaccinated? And, it's just, we have this mindset, I think, of like, we don't hear about it, so why should we worry about it?
Right. So vaccines are, they've done their job. So they have eliminated the disease. It's not completely eliminated them, but for the most part, a lot of the diseases. As vaccinations drop off, we see those diseases reemerge, or we will see them reemerge. So when we use meningitis as an example, meningitis is rare. It's a rare illness. But the problem with meningitis is those that do survive have long-term effects of some sort. Loss of hearing, loss of limbs. They can have a blood disease called sepsis, which can then cause other issues in the body and other organ problems. And then ultimately, people do die from meningitis. Meningitis is something that comes on really fast. The symptoms of it are often initially ignored: headache, a fever, and body aches. We can attribute that to many, many things when we're talking about a high school kid or college kids. College kids especially, you're away from your parents, you're busy with school, everything that college has to offer. You don't have anybody there kind of overseeing your health or anything at that point. So the disease comes on fast, and there isn't a lot of time to seek help with meningitis. That vaccine starts at the age of 11. It can be given down to 10, but typically we give it at the age of between the ages of 11 and 12. That's when we see kids get most involved in the activities that make you more vulnerable. So you're involved in more organized, larger sporting events or groups, locker rooms, more close contact in classrooms. When we get into middle school and high school, they're just bigger classrooms, more kids in a smaller area. Then when you go on to college, of course, you've got dormitory-like living situations that you're just more vulnerable to the disease because it's passed on through close contact. Not necessarily intimate contact, but close contact. Sharing water bottles, sharing lip gloss, kissing and things like that can pass it on. So you just, starting at those age groups, you just happen, you see people partaking in more things that make you more vulnerable. So,
and it's just getting that vaccine just makes you so much less likely to contract something like that. Like, how effective is the vaccine in preventing meningitis?
I don't know the actual percentage, but it is one of the ones that is more protective, has a higher efficacy, and especially if done ages 11 and 12, 16 to 18, prior to being exposed or becoming in a more vulnerable population, and then going on to college. There are more doses that are recommended if you stay in a certain, like let's say you stayed in college in dormitory-like living situations, past that 5-year mark. There is recommendations for further boosters, but that's more on a where are you at in your life at that age kind of thing.
Okay. And for parents and caregivers who are putting their kids' vaccinations on their back-to-school checklist, how can they make sure that they are getting that done prior to the school year starting?
So there's many things that can be done, but the most effective thing would be a yearly physical. If you're going for your yearly physicals, vaccines are going to be addressed at each one of those appointments. Now we know that doesn't always happen for many reasons. People are busy. Insurance issues can be part of it. I think we have this idea that if I'm not sick, I don't need to go to the doctor. Kids get to a certain age and, middle school and high school, and we do kind of fall off on those because the kids aren't sick. They're busy, and we just see it as, why do we need to go to the doctor if we're not sick? But those yearly physicals, address milestones, other things that could be going on in their life. There's other things besides true medical issues that get addressed in the doctor's office. And those vaccines then would get kept up on each of those appointments. And the goal would be to give them as what we call at earliest eligibility. So if you can get a vaccine starting at the age of 11, get it at 11. Don't wait until you're 12 or 13, getting ready to start 7th grade, and then you're panicking. If you get it at 11, you're done. Mm-hmm. Same way with the one that's required at the 12th grade level. If you get it at the age of 16, not waiting until you're 17, 18, right before 12th grade starts, you're done, and you've gotten it out of the way. So yearly physicals, but we know that doesn't always happen. So there are, if you need help, the first point of contact would be your PCP. It's reaching out to your PCP. That's the best starting point. If insurance issues happen, if you need navigating through that whole system, the health department can help with that. We have the VFC program, which is a federally funded program that focuses on uninsured, underinsured, Medicaid enrolled, Native American, Native Alaskan. And then we also have a triage process at the health department that can help wade you through if you do have a PCP but you can't get in, or you haven't been there in a couple years and you need to reestablish care, or you need help finding one. We have a process in place. We ask a series of questions and we can help navigate that. So that's really the best way for people to get kids vaccinated and start the school year off, right?
Yeah, so go to your primary care doctor, your family physician.
Yep.
That should always be your first stop. But if that's not an option, which it might not be for some
Yeah.
people, if you're uninsured or underinsured, at the health department, we're there to help you out. You can
Yep.
give us a call and we'll get you set up with either, redirecting you back to your doctor if that is an option, or we'll be able to take care of it and help you out down at the health department.
Right. Yeah.
Awesome. And I guess going back to that 6%, is that something that you are worried about? And is there anything that we can do as a health department to make sure this number stays as low as possible? What are the steps that we take to ensure that? And then what can everyone else do to make sure kids are up to date on vaccines and ready to go by the start of school?
Right. So there are concerns about that number of religious exemptions continuing to rise. And if we don't continue to educate the community, educate against misinformation, disinformation, we're going to continue to see that number rise. Although it's a concern, I don't think it's anything at this point anyway to get really, I don't know what the best word for it is, to get
Amped up about?
Yeah, amped up about, exactly. I always think of it as if all of these students that are on exemptions all went to the same school, lived in the same community, shopped at the same store, and they all stayed within, it wouldn't be of that concern because they'd all kind of be living all within each other. But we know that's not true. They're scattered through all of Polk County. We all live in and amongst each other, shop, sporting events. And so you've got those kids that are under-vaccinated kind of all spread out everywhere. And so that makes it more of a concern. But the goal is just to keep educating, keep talking about safety and efficacy, keep educating the parents and the community, talk about how far we've come. We used to see all these diseases. We used to have people paralyzed, die, lifelong health issues because of these diseases, and we don't see that anymore. So we have to remember where we've come from, even though we don't see them anymore. Because if the numbers continue to drop off, we're going to see those diseases reemerge, and that's not what we want to happen. 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 And that's not what We don't want to give the diseases that opportunity to come back.
And I remember when I was growing up, it wasn't much of a conversation, right? It was just something that you
did.
went and did and you needed to. And now obviously it is a bigger topic of conversation, I think because of what happened throughout the COVID pandemic and just many other reasons, I'm sure. But yeah, it's just a topic of conversation. And I think it's an important one, to your point, that we engage in. Just having that conversation with our families and our
Right.
communities is going to go a long way in making sure that people understand what these vaccines do, and that if we don't get kids vaccinated, there is a risk of them contracting one of these really scary illnesses.
Yeah, exactly.
Any final words on childhood immunizations? School will be here before we know it.
I know, it's not very far away. First day of school is what? August
August.
25th, 6th-ish, somewhere in
We'll
there,
go with
I
it.
think.
Yep.
Yeah.
That sounds good.
Yeah, so just, I mean, the main, if people need help, we're here to help, no matter what that kind of help is. If it's just navigating, if it's actually immunizing your students, if you're looking for information, if it's a community group that, needs information to target your populations, whatever we can do to help, we're here to help.
Awesome. Well, thank you for joining me on this
Absolutely.
very first edition of By the Numbers, a public health podcast. And we'll have many more topics to come in the future. We'll talk about syphilis, our gun safety campaign. We'll be talking about HPV and cervical cancer in the near future, just to name a few. And we'll have a number of guests on from both the health department and then external groups and folks that we get to work with at the health department. So we're just really excited about it. And if you've made it this far, thank you for listening, and please keep an eye out for upcoming episodes by following the Polk County Health Department on social media. Thank you.
Thank you.